So you wanna become...
Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Drs. Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Hey, it's Dr. Butz back with the Fuller Butz podcast. Dr. Fuller, how are you doing today?
Doing great. How are you doing, Dan?
Excellent. Spring's coming up, it's sunny and warm. Lots of positive feedback about some of our recent podcasts. What have you been hearing so far?
Yeah, just a wonderful response from our viewership. I'm excited to report that we've been listened to in 6 different countries and over 100 different cities. And especially on Spotify, there's a Q&A portion. So we've had some really great comments and feedback as far as what they liked about the podcast, some different topics that we can talk about. And actually something that comes up commonly in the office and on the podcast, and a lot of times in our DMs on Instagram, is the topic that we're talking about today, which is
liposuction, one of the most common procedures performed every year.
And Dan and I were just talking prior to the podcast in order to prep, and Dan just pointed out that it's really one of the most misunderstood procedures as far as what the risks are, what the potential benefits are. A lot of different variations of liposuction that's all clumped into one category. So we're hoping to really provide as much basic information about it so that everyone who's done reading and listening to this podcast, whether it's the closed captions, the audio, the visual that's available, comes away learning hopefully 4 or 5 new, interesting, and safe things about liposuction that they can either help themselves out, tell a friend, or just share the information. So we're just here to educate and hopefully entertain.
Yeah. So I guess jumping right in, what is liposuction at its very essence? Like, what are people trying to accomplish when they come in or when you're trying to do liposuction?
Lipo or fat, suction or suck, you are literally sucking fat out. And so that is just the bare...
Like to lose weight.
So liposuction is not a weight loss treatment. And that's just important for us to know. A lot of patients say, oh, I just want to lose 10 pounds. Can you just suck it out? And that's not really the benefits of that. And, what do you tell patients who come in asking that question, Dan?
Yeah, I always tell them that, the scale might not shift all that much. BMI typically doesn't change too much, but it's all about contours. So we're trying to really shape areas that are maybe difficult to lose. So the love handles, hips, the abdomen. So it is a very powerful tool, but it's not a weight loss strategy. You can't target that visceral, stubborn fat inside the belly. So when people come in and say, I want to lose, 5-10 pounds, like, well, liposuction might help, your clothes fit a little bit differently, but if you really want to lose weight, you should talk to our wellness nurse about, different weight loss strategies, which can often make an almost bigger impact. Maybe not get rid of those difficult love handles in certain areas, but can, really shrink their BMIs dramatically and have health benefits as well.
So I'm really going to hammer this home. Dan, question, is liposuction a weight loss tool?
No. Liposuction is not a weight loss tool.
Okay. And so I already just described in bare detail, liposuction is literally sucking fat, but there's actually a little bit more to it than that. And so what does liposuction consist of as far as what products or medications are actually being used during liposuction, Dan?
Yeah, so liposuction, in small volumes can be done safely under local anesthesia, but more commonly, larger areas, volumes we're doing in general anesthesia. Typically, small, 1 centimeter incisions. We inject a lot of this tumescent agent, which has a numbing portion, and epinephrine, which constricts the blood vessels, really decrease how much bleeding there is and bruising. That allows us to then suck out the fat in those areas. And this is just a superficial fat, kind of what you can pinch. Common targets. What would you say your most common targets are for liposuction?
For me, it's the love handles or the flanks. So it's the area that's just by the hip bone that kind of folds over the pants. It's metabolic weight. It's really hard to lose that. A lot of patients do a great job of nutrition, of dieting, of exercise, and they get to their goal weight and they still have this just troublesome fat on their outer hips. I would say just below that is what's called the saddlebags or the lateral thighs. I would say that's also a big area where liposuction.
Like my least favorite terminology in all plastic surgery, but there's really no other way to describe it.
Yeah, just like if you're doing Botox and you say, "Oh, like, do you want to treat your crow's feet or something?" Then I feel like I'm insulting the patient. I think that's not the medical term, but I think that the saddlebags is a really good way to visualize that.
Right.
I think Western movies are a little bit out of date, so maybe the younger patients don't understand what saddlebags are anymore. But saddlebags, and then I would say a lot of patients ask me about their medial thighs or their inner thighs. And I always talk about that with some caution. And so, Dan, when a patient comes in and says, "Oh, I really don't like this medial thigh fat," what are some of the key points that you're telling them about that specific area?
Yeah, I think this applies to the entire thigh. I mean, especially the anterior and posterior thighs. I think people come in like, "Oh, I like liposuction of my thighs," thinking they can shrink their whole thighs. The thighs have one layer of fat, and it's really unforgiving. You think about cellulite and kind of all the dimples that often happen just naturally. Liposuction can just make that a lot worse unless you have really great skin tone. So I tend to tell patients I'm super cautious there. I kind of try to shave it down a little bit, but it's really easy to take off way too much and make really, difficult to fix divots. So yeah, inner thighs, I kind of just target the upper pouch. Outer thighs are great if you have that kind of saddlebag. The anterior thighs, I don't really touch, or posterior thighs. I think they're just a recipe for trouble.
Yeah, to me, those are what we term in plastic surgery zones of adherence, or areas that I really don't want to go. I don't want to disrupt the overlying skin connections to the underlying muscle and fascia, and your IT band or your iliotibial band that's running down. You can actually feel it as you get closer to your knee. That area that's tight, there's not a lot of fat that's there. That's also an area that you don't want to disrupt with liposuction. You can drop and really cause a lot of contour irregularities. And then specifically for the medial thigh, I'm really telling patients that I'm a minimalist there. I want to suck out some of the fat, but certainly don't want to hollow it out. Don't want to create this paper mache, very thinned skin. And then I'm really hoping that it's a combination of removing some fat, but also the trauma of the surgery, just allowing things to be a little bit stickier there, to be a little bit tighter, to hopefully bring that down. So that brings me to my next topic, which is a little bit of a pop quiz for Dan, but he's really going to use this as a tool to educate us on different types of liposuction. And so, the most basic or the historically relevant type of liposuction is what's called mechanical liposuction, or just straight liposuction. And so, Dan, just take us through, just a couple of basic ideas or principles as far as what mechanical liposuction is.
So it's very mechanical and physical, like you're talking about. It's a long cannula attached to a vacuum and a canister in between to capture the fat, and the surgeon is using their arm to go back and forth and kind of suck out the areas and try to sculpt those certain spots. So fortunately, there's been a lot of advances in liposuction technology, and sometimes it can get confusing with the buzzwords, and people like to put their own marketing spin on things. But back in the 70s, when it really first started, they weren't even using tumescence. It wasn't until Klein in the late 80s, 90s that they started using more numbing and made it much safer. And now we have common tumescent liposuction.
Don't jump ahead. Don't jump ahead. We're gonna get there. So don't answer questions that weren't asked.
Did I answer that question adequately?
Sure. So mechanical liposuction, essentially, the surgeon is working very hard, placing the cannula in and out of the body with suction on it to try to harvest as much fat out that goes into a canister. Jumping to the next topic, what is power-assisted liposuction?
So power-assisted liposuction is kind of a more advanced form of mechanical liposuction, but instead of the surgeon requiring to use every stroke is based on their arm stroke, the power portion has a hand piece that goes back and forth really quickly. That's almost like a turkey carver that allows you to be much more efficient. allows you to get more fat out, without as much really surgeon fatigue, because it can be quite it's a lot of work to do larger volume liposuction. And
So
PALS makes
the
it much more
marketing,
efficient.
yeah, the marketing for PALS is that I think it helps the patient in that the surgeon's being less forceful. You're not have to really
Yeah,
dramatically pull as much fat out. And then it's also better for the surgeon because you're not having to work as hard for that. The vibrations or the repetitions of it oscillating back and forth really does make it easier to harvest fat in a safe way. And so the power of it really is, as Dan said, the handle and the oscillating vibrations that make it work more efficient. There's no heat, there's no lasers, there's no burning or chemical reactions that are going on. That's what the essence of power assisted liposuction is.
yeah, and that vibrational force does help kind of get you through and break up some of that fibrous stuff as well, which can be very helpful in some of those more difficult to get at areas.
Okay, Dan, and I'm dying to know, what is laser liposuction?
Yeah, laser lipo, some people call it smart lipo. Basically, after you do normal liposuction, so really the first step is normal liposuction. And you go through those areas and you apply certain wavelengths of laser. And the thought process is that this was going to, tighten the skin. Unfortunately, and this is still commonly marketed that it tightens the skin, but all the data shows that it does not actually tighten the skin. It does maybe reduce bleeding or blood loss a very little amount, but again, it's not all that substantial of a benefit. Some people who purchase machines still definitely probably use it and advertise it, but it hasn't really taken off. It's been around for quite a while.
Yeah, so laser liposuction, I tried to review it just because it's not a part of my practice, just to get some of the principles down. And some of the descriptions of how it works really terrified me. It was, saying how, thermally, you're thermally burning or shrinking the cell tissues, you're causing cell death. And with doing that, that's going to cause a reaction that's going to thereby tighten the skin. And certainly, as we're hinting at, there are risks of burns, of irregularities, of waviness or unevenness, just because some areas may be more traumatized or burned than others. And so I think that there's a higher risk of unevenness for anytime you're adding energies to that specific type. There's certainly more, I would say, safer or more efficient ways of doing it than a laser.
Yeah, there's been a lot of new devices to try to tighten the skin. Laser is one of the earlier ones. Am I preempting your questions?
You are. Yeah, if you just stay in your lane, that would be appreciated.
All right, I'll wait.
So, do you want to talk about Vaser?
Yeah, Vaser. So yeah, Vaser liposuction or ultrasound assisted liposuction uses ultrasound probes to go in and they talk about cavitation and liquefying the fat. Basically, they look at the fat as these little grape cells, grapes on a vine, and the ultrasound knocks them off. So the Vaser itself does not actually remove any of the fat, but it kind of makes it easier to remove it. So then after you do Vaser, you go in and you suck all this fat out. And there is some heat created with this as well. Some talk about, it might tighten the skin a little bit. And you can kind of see that all the holy grail, the missing piece of liposuction is often skin tightening. Does not, that's often the missing piece when you just take out a bunch of fat, is how that skin is going to retract.
I'm going to skip over one question and just go to another topic. High def lipo, like that's just another kind of marketing term or different technique, but that's just another question that comes up in my office, or I see Instagram posts saying, oh, this patient received high def lipo. So what is high def lipo to you, a board certified plastic and reconstructive surgeon?
Yeah, high def lipo is essentially, more common liposuction techniques are really focused on removing the deeper layer of fat and trying to preserve a thin layer of fat on top so that you get a smooth outcome. High definition liposuction, again, takes out the bottom layer first, and then that top layer they go in and try to etch in definition. So normally trying to kind of create muscle definition, high def, six packs, certain areas to kind of make you look more sculpted. I think, again, this is a very high risk, high reward. in the right hands, and there's some guys in Colombia, Hoyos, who can make, it might be the right patient population, but make people look like sculpted bodybuilders. But in my patient population, coming in generally higher BMIs, I think if you put in abs in someone with a BMI of 30, it's going to look silly. Doesn't how that's going to age? To gain weight, lose weight. I think it's a lot less predictable, and if it doesn't heal down quite right, there's kind of much again higher risk of bad outcomes. So one of my favorite terms I tell patients when they ask about high definition is I prefer low definition liposuction. I want to highlight what should be natural highs and lows, but not necessarily give you a six-pack if you don't naturally have one.
So Dr. Butz, when you perform low def liposuction on me, will my fat come back?
If you gain weight, your fat cells that are there will get larger, right? But the fat cells removed cannot get bigger, but you still have full capacity to gain weight. And a lot of patients are concerned. I feel like I get this a lot, like, am I going to gain weight in all these weird areas? That's just not the case. Again, if you do it properly, you want to leave some fat behind. If you just take all the fat away and skin on muscle and leave fat otherwise, then you might get weird shapes. But board certified plastic surgeon is not going to do that. I see a lot of patients coming from, unfortunately, non-board certified plastic surgeons getting liposuction, and they just kind of target one area, take as much fat as possible, and they have this big divot. Then you're going to have contour abnormalities, right? So that's you still can gain weight in the areas of liposuction, but it's not going to. It often can help those really difficult areas to lose weight in, make it better contours.
So I think that's a key point just to talk about a little bit, and in that there are some strictly liposuction only centers, and I would say I did some research, and I would say many of the providers are not board certified plastic surgeons, and many of these procedures are being performed office based under local or sedation type of medications. And I guess, what are your thoughts on that? Or would you ever consider patients to be not a good candidate for liposuction only? Like, who would be the perfect candidate for liposuction only? And then who should be choosing to have a board certified plastic surgeon perform, let's say, a mommy makeover or a tummy tuck rather than liposuction of the belly? And keep your answers brief, sir, please. You're on the hot
Yeah,
seat.
that's a complicated question. I think regarding non-board certified surgeons doing liposuction, I think our hot topics conversation a few weeks ago really went into pretty good detail about that. And really, you want to be doing good research, finding a surgeon who does a lot of what you're looking for and does it well, not just necessarily someone who advertised about a national company who does the stuff under local anesthesia. Who is the best candidate for liposuction? Unfortunately, it's often the patients who don't want it, right? It's our mid-20s, normally BMI of 23 to maybe 26, just wants, improved contour. Unfortunately, I see a lot of patients come in, they've had 3 kids, BMI 28, loose skin, and kind of struggling to lose weight. And really, obviously you want to save a weight for any surgery, but probably a tummy tuck's going to give you the most dramatic result. Just liposuction of loose skin, it tends to be not make more contour abnormalities and more loose skin.
It's funny because I was just messaging with a previous patient of mine who's very happy after her mommy makeover, breast aug, tummy tuck, who has a friend or a work friend who is considering going to a liposuction only place. She's a mother of 5. I've not met her, but as far as getting liposuction only, she's been told apparently that, we're going to tighten your skin during the liposuction process. And and I actually went on this national center's website, and they basically compared tummy tucks to their version of liposuction. And basically they said that, I don't want to get into some hot topics. Maybe we should save this for another one. But they essentially said that for skin tightening, liposuction tightens skin, and as well as tummy tuck. They said that they don't do a rectus plication or tightens muscle, but they say that it's safer because of their anesthesia that they use, and the recovery is faster. What are your? I mean, just to describe that again, because I find it hard to believe that a liposuction procedure can guarantee skin tightening, especially to patients who are coming in who are mothers of 5 kids. I mean, obviously there's going to be some skin laxity there. And just before I bounce it over to you, I will just say in my practice, it's very common for me to tell patients that they're not candidates for plastic surgery, like they're not ready, or they need to get into a better condition to be successful, that they would do better with X, Y, or Z, or some other treatment regimen. And I've yet to have a patient come in and say that they were told by a liposuction center that, oh no, you don't need lipo. Like, it seems like they're doing it to anyone and everyone.
Yeah, it's the it's the strategic manipulation of marketing that is really, I think, just kind of plagues the cosmetic kind of world, unfortunately. Liposuction creates skin laxity for the vast majority of patients who are over 30 for sure, unless it's like you're just hitting the love handles. And even with Renuvion, laser lipo, all these devices, they can help a little bit, but they're not going to create a tummy tuck-like result. They do not tighten the muscles. Exercises do not tighten the muscle, the diastasis rectus. Really, I mean, tummy tucks are the kind of gold standard to restore the abdominal wall strength, the skin tone after multiple pregnancies.
I think
you're pretty fired up.
Yeah, I know. I'm gonna let you take a deep breath and try to de-stress over there. So I would say you answered, I think, it very clearly. Patients who are great candidates for liposuction only are typically younger because they have more elastic skin, where you would expect that to rebound down. They have excess fat, but not excess skin. So things have not changed a lot from weight gain, weight loss, pregnancies, things like that. Otherwise, if there is loose skin, doing a surgery to remove that skin would be, to me, the safest way to treat all of the issues. And essentially I tell patients, I make an inventory or a problem list as far as what's wrong, what we need to fix, and then we address them. If we're not addressing them all with the procedures I'm offering, then the expectations or the results are not going to be where we need to be. So Dan, what are some I would say just risks with liposuction in general, or specifically liposuction only? Like, what should patients be aware of if they're going to be going someplace to just get liposuction? Like, what could go wrong or what could happen, both short-term and long-term?
Yeah, I mean, when I go over my consent forms, I mean, there's 20, 30 things on there. I mean, 99% of the time, none of those things happen. The most common...
Board-certified plastic surgeon.
Right. So we take a lot of safety precautions to make sure of that. The most common issue I think can occur with liposuction is probably contour abnormalities. If you're too aggressive, too superficial, again, if you have skin laxity baseline, it's typically only going to get worse. If you have a little bit of laxity, I've had a few patients where it retracts. I think that's where these companies get these great before and afters. You get those random patients that have great results with just lipo, but that is by and far not the norm. So contour abnormalities, I mean, there can be really tragic things. I mean, you can get skin burns, you can get wounds, you can get seromas, there's been incidents of organ perforation, people go deep into the belly. So it's not necessarily a totally risk-free procedure when being done by not well-trained people.
So Dan, if I get liposuction at one of these low-cost centers and I'm not happy with the results, it's an easy fix, right? It's just super easy and simple to fix that.
Yeah, so unfortunately all those contour abnormalities, it's scar tissue. So I mean, normally we go in for a tummy tuck and we can raise up all that skin. We know where the blood supply, make sure that things are going to heal properly. But if there's been a bunch of liposuction trauma, scar tissue that often tethers the skin, it can. So, I mean, I've seen patients that I don't have a thing I can offer them to fix it. It's so bad. It's tethered. It's loose. It's lumpy, bumpy. There's just really nothing you can do.
Yeah, I had a patient who came to me after going to Chicago for their liposuction, uh, and this is a story that I've heard several times. But they met with a surgeon, and then they didn't see that surgeon. The day of surgery, it was a different surgeon, and then they were seen post-op 1 week later by a different doctor. And so they were never seen the same time by the same surgeon. A different surgeon who had never evaluated them actually performed their liposuction. She had significant contour regularities. She had some pictures from before the lipo and then after. She went back there and they said, "Oh, you need more liposuction to fix that." And so they weren't doing it for free. They were going to make her pay for more. And she came to see me, and fortunately, I was able to offer her an abdominoplasty or a tummy tuck to remove the loose skin and get rid of that. But as Dan was alluding to, that's not a simple fix because some of the trauma, the scar tissue, the fibrosis of the tissues are not as elastic. So it's tighter. It's a little bit more challenging to get rid of some of those contour regularities. And you're not going to be removing as much skin necessarily because a lot of that has just been scarred down. So it's a challenging process. You want to get it right the first time. Dan, do you have any thoughts on that? Or I'm sure you've had some similar situations.
Yeah, no, 100%. I mean, I see it all too frequently, unfortunately. I mean, I always tell patients I want to do the right surgery the first time, not the easy one. I think liposuction often seems like an easier option than, say, a tummy tuck, but it just does not.
Why? Why do you think why is it easier? And go ahead.
Yeah, I think people think of little incisions. I mean, tummy tucks are a big surgery, but they provide big results. You're tightening the muscles, you're bent over, but it addresses the whole complexity of the things that are going on.
And this is just based after me Googling some other lipo centers, but how they market is that it's cheaper and it's a faster recovery. So they're saying how long and drawn out tummy tuck, recoveries are. And I think we heard in maybe our second podcast, even drainless tummy tucks, or patients are walking around, moving around, patients are returning to work 1 to 2 weeks later. It's not like you're in bed, you're not hospitalized. And so they're trying to dramatize the surgery, but ultimately, Dr. Butz and I agree that if you want a big result, something that's going to be dramatic and lasting, you have to do a big surgery. And sometimes that means making an incision, and seemingly it seems like a big step to take, but it's safe to do. The results are very reliable, and in good hands by board certified plastic surgeons. You're going to get the body that you are desiring, and not trying to cut corners or be dissatisfied by trying to take the easy route or seemingly the faster way to get there.
Let's not totally dog liposuction, though, right? I mean, it is a very powerful tool. You can get great results in the right patient and the right areas. We use liposuction, assuming both of us, for pretty much every tummy tuck to help contour and improve upon that result. And the back area, probably 75% of tummy tucks I'm doing, we call 360 or circumferential liposuction at the same time to really contour the entire torso, upper, lower back, often the thighs as well. Sometimes we do arms. Submental liposuction is a great tool for that. And if there's not a lot of loose skin, to help improve that.
100%. It's a great modality and tool to use. It just can't be the only weapon or tool in your toolbox.
It's like the hammer, right? If all you have is a hammer, everything's a nail. I think that's why we want. When I go somewhere where they have all the modalities, not trying to just force you. Same with like Cool Sculpting or any of these spas that just happen to offer one thing. You're going to get kind of pigeonholed into whatever they have to offer. Whereas we can offer all of them, or most of them, or at least say, maybe you don't need a tummy tuck. Maybe you could, even if you don't have something else, kind of downgrade it to a less invasive thing.
Yeah, I think that's a great reflection for us to take a step back and say liposuction is great. We do it commonly. It's wonderful. Like that's the topic of our talk, but we just want to be very realistic as far as expectations of what liposuction can offer you. A lot of that is, if you're looking for reduction in fat and contouring, that's a great tool. If you're expecting that to tighten the skin and get rid of laxity and stretch marks and things like that, I think that we need to be realistic about it. But brachioplasties, arm lifts, liposuction only can be a good tool with patients with good elasticity, with not a lot of loose skin or massive weight losses. 360 lipo that you've talked about. You had mentioned to me that you have a great case tomorrow, and I think you're using Renuvion, which you haven't talked about yet. Do you want to talk about Renuvion and indications?
Renuvion is a radio frequency coupled with helium plasma, which creates heat, which you talked about earlier. That can in theory be scary, but it's a very quick kind of instantaneous kind of blast of heat, and it attracts to water molecules. They get hot, and then it goes and finds a new one. So you're not getting bulk heating, which is often to blame for these burns. It's kind of always finding a new target. So it's been shown to be very safe, FDA approved. And I frequently use it with mini tummy tucks or tummy tucks in these areas that can be a little bit more, just loose skin, but we don't maybe not loose enough to justify, full torsoplasty or something. So tomorrow, doing a mini tummy tuck, has a really bad C-section scar, not a lot of laxity up top, doing a bunch of liposuction, and then you can do the whole abdomen liposuction, Renuvion there, back as well, outer thighs, and then she has hip dips, putting some fat in the hip dips to really kind of just shape everything. And she, given her existing skin tone, should have a really nice result. If I just did liposuction, probably be a little bit loose, but since she has good skin tone, liposuction with the Renuvion, I think it helps address the little bit of laxity you would have if I just did lipo. If someone needs tummy tuck, I'm like, let's just, I don't like to do the easy thing. I always want to try to do the right thing. But
so who are good candidates for Renuvion? Like who are the people that you're pushing that are really feeling like that's worth it to get?
I think your patients who are maybe kind of in the in-between, like the perfect liposuction candidate, 23, no laxity, just a little bit of contour, probably doesn't need it. But when you're kind of getting into that, late 20s, mid 30s, maybe, no kids, one kid with a little bit of laxity, but not too bad. And just liposuction might create some laxity. It's going to just tighten it up a touch. And I try to set realistic expectations. I want my results to beat my expectations, not, be below. So I think it just takes liposuction to the little bit, one level up what you typically would see in terms of the skin tone.
And what type of anesthesia are you using for liposuction cases?
98% general anesthesia. Occasionally someone just has a little lower abdominal pouch, or maybe the love handles I'll do in office, but if it's going to be more than, a liter of tumescence, maybe that's even too high. I often tell patients I can get a better result in the OR, where I can, not have to worry so much about, every little pinch they might feel, because it can be hard to get fully numb, and I want them to be comfortable.
That's great. That's a great overview. I just have one last question, because it's commonly asked. What is recovery like after liposuction only? So let's say someone's going to get, not a lot of skin taken off, not a adjunct procedure, but we're just going to get liposuction. Like, what kind of recovery is that?
Yeah. I tell patients it's like, I feel like you maybe got a little beat up, like did a really bad ab workout, or just kind of sore generally, but, normally it's not all that bad. Tylenol ibuprofen is really adequate. Maybe give you a couple of pain pills for the first night, just in case. The biggest thing I prepare people for is that there's going to be some leakage from the incision sites. So normally the lower back where you're sitting on, or if you're doing a BBL or fat transfer to the butt, sometimes the abdomen, some of that fluid is going to seep out. Some people put drains in. Again, patients hate drains, so I don't typically want to do that. So some of that's normal for 12 to 24 hours. Then it's just really the most annoying part of all of it is compression. I want good compression for about 6 weeks. I often talk about lymphatic massage, but it's kind of a hassle a lot of times, and you got to get it. Most patients probably don't need it, but it can help for really more of those. When you do really big cases or a lot of the Renuvion, not mandatory by any means, in my opinion.
What does compression mean? Like, can I just wear my Lululemon joggers?
Yeah. It's also, there's a lot of controversy over that. I tend to use, people refer to as a faja style garment. Depending on the areas, it's pretty tight compression, but the really key things we want smooth. So Lululemon joggers often have to worry about, they kind of create a band of compression and often the wrong area. So you want to make sure you have smooth compression, no creases, no any extra constriction anywhere that can almost create a contour issue. I often do use lipofoam in certain areas as well to try to kind of get extra compression. And there are different stages. I think some of these really aggressive stages, though, stage 2, can often become like shapewear, where you're just kind of forcing your bodies into positions. And I think this is something you have to watch out for. If you see like someone post a 6-month review and they've got these tight lines on their body because they're wearing these really aggressive garments, like, is that really the liposuction result, or is that just basically pretty crazy aggressive body contouring garments that are forcing their the abdomen skin into certain directions? Once you take those off for a while, oftentimes again, that's when you start seeing some of the true results.
Yeah, I've started to ask my patients at 3 months, 6 months, a year, they're not using compression garments, but I guess even at 6 weeks, to just not have their compression garment on the day of their visit, just because I want to take some pictures, and all the times you're seeing those lines, and I kind of want to see what it looks like, and then just for photography's sake, like I want it to look not crinkled or not like reddened by the type.
You don't see the real result, right? Yeah. So I stop compression at 6 weeks. Some patients will do a little bit more. There's swelling still, but then I do photos at 3 and 6, and it's very unusual that people come in.
Yeah, especially in colder weather months. After 6 weeks, I say if you can tolerate it and it feels good, keep going, because I would say it's only going to help even for another 4 to 6 weeks after that. If you can keep things tight, there's going to be ebbs and flows and healing. But yeah, the 6 week is kind of the mandatory rule for most of the surgeries that we do.
Do you have any other opinions on lymphatic massage? I mean, some people make everybody do it, from day one, essentially. I'm kind of more of a try it, but no.
Not for liposuction only. I do feel that when you're making big cuts on the body, such as an abdominoplasty, where there's going to be, changes to the lymphatics and the venous system, just the flows, to try to circumvent that and help that in the first couple of weeks is helpful. And I really let my patients guide me. I've had overwhelmingly positive feedback from lymphatic massage. It's not something that I mandate that they do, but I give them names and numbers to people in the area who have had positive ratings and reviews from my patients. And I say, meet them. If you want to do it once. If you feel like it's great, good. I have some patients who do it once and say, yeah, that was good, but not something I'm going to consistently do. I have other patients that say, oh, I'm feeling a little bit tight. I went back to work at 10 days. I think I'm going to call and get a lymphatic massage next week. And so to me, it's just like, you have to invest in your aftercare and your results, your recovery, just as much as the surgery itself. Like, let's throw the kitchen sink at it, make it work, listen to your body, do what feels good. But as far as strict liposuction only, that's not a lymphatic massage indication for me.
Yeah, I think it's a good tool. Going to be a good adjunct, but not everyone needs it. Kind of, carte blanche. What else? Have we missed anything? I think that was a pretty good overview.
Yeah, I mean, the only questions I had left were really talking about, general anesthesia and risks of, anesthetics and sedations and stuff. And I think we table that for next week and just have a discussion on anesthesia and plastic surgery, just because we've mentioned tumescent, we've mentioned local, we've mentioned sedation or general anesthetic. And I think that's a big question that patients ask or have fear of, just as much as the unknown about surgeries or tummy tucks or liposuction. And so if we can try to calm people down and reassure and just provide information for as far as what anesthesia is offered during plastic surgery procedures next week, I think that would be a great topic to continue to debunk, demystify, educate, and keep things fun.
That's right. Yeah, anesthesia is a great topic. I feel like that's oftentimes patients' most fearful part of all of it. They come in like, I'm scared of anesthesia, right? So yeah, that'll be a good one to talk about.
Absolutely.
Yeah, there's probably, could have probably spent another 40 minutes talking about liposuction. Could go down all sorts of rabbit holes, but definitely a good overview. Safe, it's a great adjunct. It's great for the right patients, but, you want to do the right surgery, not the easy one, right?
Absolutely. Agree. Thanks for joining us. Remember to follow, write comments, give us suggestions, and thanks for your time, and have a good rest of the day, guys.
Well, signing off.
Thanks so much for tuning into this week's episode of Fuller Butts, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @SFullerSurgeryMD or at Daniel Butz MD. That's Butz with a Z for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.